Sometimes a series of similar or related incidents occur. For example, a particular work area might have a high number of manual handling injuries or work-related violence incidents. When this happens, it is generally helpful to consider these incidents together rather than in isolation. A cluster review helps you to do this. A cluster review aims to review a group of incidents together to identify contributing factors and actions that can be taken to prevent similar incidents from occurring in the future. Individual incident reviews should still be undertaken for each individual incident before conducting a cluster review, as this ensures that you have all the relevant details of each incident in the cluster. Cluster reviews involve identifying a particular type of injury, such as falls or strains, a particular department or area of the workplace where injuries have occurred, or specific groups of workers who are at higher risk of injury. Cluster reviews can be particularly compelling in justifying actions, for example, purchasing new equipment, as they are based on several incidents rather than one isolated incident. In this video, we will use an example where a series of incidents occurred in the birthing centre over a 6-month period that were related to awkward and prolonged postures causing staff injuries. To start a cluster review, navigate from the home page to the Reviews tab and select the individual reviews that you would like to cluster together for review. If the series of incidents happened in a particular time frame, you can filter your existing reviews by date. Alternatively, you can filter existing reviews by review characteristics like hazard type, level of harm, and location. In this case, I might filter by hazard type. Select the incidents you would like to review and click Create Cluster Review. Assign the cluster review to a reviewer and then click Create. From this point, the process of creating a cluster review is similar to creating an individual incident review. First, you will be asked to fill out the consultation checklist to help you identify relevant stakeholders to contribute to the cluster review. When doing so, it is important to use a systems thinking approach and consider who may be important to consult beyond just those people who are directly involved in the incident. To help you consult effectively, the toolkit includes a consultation framework to guide you in identifying relevant stakeholders across the system, including health and safety representatives, frontline staff, operations management, administration, and external influencers. Using our example of staff injuries from awkward and prolonged postures in the birth centre, we may decide it will be important to consult health and safety representatives, frontline staff, for example, midwives, nurses, and theatre staff from the birth centre, frontline management, including the nurse unit management and the patient handling coordinator, the occupational health and safety team, the procurement team, the training team, and the unions. Select all people you think would be important to consult and click Save. Next, you will be asked to provide a summary of what is being analysed in the cluster review, including features common across incidents and the risk control measures that were in place. Before completing this step, it is recommended that you go back and read the incident summaries of each incident included in the cluster. This will help you write an accurate cluster summary and identify the common contributing factors across incidents. In this example, the cluster review was initiated because the birth centre had the highest number of staff injuries in the hospital over a 6-month period. A cluster review was undertaken to get a more holistic picture of the complex system of risk factors leading to awkward and prolonged postures and subsequent injury. Common features of the incidents in the cluster include the location of the incident, the hazards experienced, and the outcomes for staff. Existing risk control measures in place included training and equipment. Once you are happy with the information you have provided in the cluster summary, click Save. As with an individual incident review, it can be helpful to have a timeline of events, tasks, or features that are common to the reviews included in the cluster. To add an event, task, or key feature, click Add Event. For our example, we might first add that patients were labouring in the birth centre. You can continue adding events to the timeline by clicking on the plus icon. For example, we may add that staff were required to monitor fetal heart rates and adjust patient positions. To do so, they used unsuitable equipment which resulted in them adopting awkward postures. This led to staff injuries. Once you are satisfied with the information provided in the detail stage of the cluster review, click Continue to progress to the factors stage of the review. Now you have progressed to the factors stage of the cluster review, where you will populate an AXIMAP to identify the common factors that contributed to the cluster of incidents. A cluster review AXIMAP will be pre-populated with factors identified in the individual reviews included in the cluster. The numbers in the AXIMAP indicate how many times a particular factor was identified in the incidents included in the cluster. To complete a cluster review AXIMAP, you should first check that each of the pre-populated factors is relevant to the cluster, and if so, provide a description of that factor. In line with the systems approach, it is recommended that you start at the equipment and surroundings level and move your way up the levels of the system. For example, we may decide that the availability factor at the equipment and surroundings level is relevant and provide a description of this factor. To do so, click on the availability factor and navigate to the Descriptions tab. Before writing a description, it is useful to see how this factor was incorporated into the prior reviews included in the cluster, as this will help you write an accurate description of the factor to be displayed in the AXIMAP. For example, for availability of equipment, we might say that best practice equipment was unavailable. You can also choose to provide suggestions for improvement. For example, we might suggest that the birth centre purchase new best practice equipment, including fetal heart rate monitors and birthing beds. Continue this process for each level of the system. For example, at the frontline level, we might select the cognitive demands factor and suggest that the birth centre is a high-pressure environment. We might also select expectations and suggest that patients expect high standards of care and so staff feel obliged to adopt awkward postures. Following this same process, check and describe factors for the remaining levels of the system, including operations management, organisation governance and administration, and government regulators and external influences. Often, as seen here, a cluster review AXIMAP will be pre-populated mostly at the lower levels of the system, with few, if any, factors identified at higher levels of the system. At this point in a cluster review, you will need to consult with stakeholders to help you identify factors at higher levels of the system. For example, you may convene a workshop to go over the AXIMAP collaboratively. In consultation with others, add new factors across the different levels of the system as needed, with a particular focus on the higher levels of the system. For example, at the organisation, governance and administration level, we might create a new factor called priorities and explain that the organisation tends to prioritise patient safety over staff safety. We might also add a factor at the government, regulators and external influences level called policies, and note that most policies are focused on patient rather than staff safety. Continue this process until you feel the AXIMAP is fully populated across all levels of the system. There are some additional features you can make use of when creating a cluster review AXIMAP, including the ability to filter factors by the number of occurrences in prior reviews, and the ability to split factors linked to more than one incident. The filter tool in the top right corner allows you to filter out factors in the AXIMAP by the number of times they were identified across reviews included in the cluster. This can be helpful in identifying which factors may be less relevant to the cluster and can therefore be deleted. For example, we might filter out factors identified only once, check these factors, and delete them if they are not relevant. You can also split factors that are linked to more than one incident. This can be helpful if a factor has been identified across several reviews but has different meanings or different risk controls. To split a factor, click on the factor and select the Split Factor button in the bottom left corner. You can then select which instances of this factor you would like to separate. For example, we might like to split the design and suitability factor at the equipment and surroundings level into factors for each individual piece of unsuitable equipment, as these would have different risk controls. This would result in 4 separate design and suitability factors for the following pieces of equipment: handheld Dopplers, slide sheets, birthing beds, and birthing baths. You can then go into each of these new factors and provide a description. Split any other factors you deem necessary.